Hello everyone, I'm Natasha Akemi Members and I'm here with Dr. Adekule Adebawo. Today we'll be talking on fibroid. Everybody knows what fibroid is. So over to you, Doctor. Doctor, please, what is fibroid?
Well, thank you very much, Madam Presenter. Fibroid is what I'll just call a smooth muscle development within the womb. The womb is the uterus. Any collection of soft muscle, smooth muscle development within the womb is what we call fibroid. And for information, fibroid can be located outside the womb, it can be located within the womb, it can be located within the canal of the womb. And this fibroid can also, the symptoms that you can have when one has fibroid has to do with the location. It's because in some places, a fibroid will not manifest itself clinically. In some cases, it will manifest itself clinically. But usually, when it comes up like that, it comes up by bleeding. And the bleeding, depending on the size of the fibroid, the bleeding may be much, may be moderate, or may be minimal. And there can be pain. And also this pain is also dependent on the location of the fibroid and the type of fibroid that you have. Because there are some fibroid, they are pedunculated, which means that the fibroid itself is attached to the womb component by a stalk. And when the fibroid rolls on the stalk, it can cause serious pain to the woman. And then, this is a serious problem, particularly among black women, because we realize that when you find 10 black women, with every 10 black women, you find about 4 having fibroid. And fibroid may not be clinically, may not manifest itself clinically, but it's a disease state that all of us must be aware of.
Okay, thank you so much, Doctor. Please, what are the signs and the symptoms of fibroid, sir?
Yeah, like I said, it has to do with the position of the fibroid. The commonest symptom is bleeding. Bleeding can be during the period, it can be after the period or before the period. And the bleeding can be so embarrassing to the women that they will have no choice than to seek retreat with a medical practitioner.
Thank you, sir. Doctor, what are the causes of fibroid, sir?
Well, we cannot say this is a particular cause for fibroid, but we realize that this is becoming common with time, because before now it wasn't as common as this. But I think it has to do with this change in lifestyle amongst women. It has to do with diet, it has to do with the use of contraceptive pills. Those are just some of the etiological factors, but we cannot say particularly that this is the cause of fibroid. But all the same, we notice that some people, it has to do with the diet. Diet rich in Western way of life has to do with increased incidence of fibroid. And fibroid is not a killer disease, but it can cause a lot of challenges for a woman, particularly in marriage and in a relationship and in lifestyle.
Doctor, I learned those that went for surgery, they died at the end. How is that possible?
Well, the thing is that when you go for surgery, by the time, before the end of the surgery, as a good surgeon, you should be able to predict reasonably well what the outcome of the surgery. The casualties that arrive from surgery relating to fibroid has to do with negligence, as far as I'm concerned, because people will pass away. I don't want to use die, but people will die as a result of bleeding. Bleeding can be during the surgery, it can be after the surgery. But when you have planned your surgery very well, I see no reason why there should be casualty in operating fibroid. And mind you, in surgery for fibroid, we have the choice of removing the whole uterus, particularly when the woman does not need the uterus again, and and we have the choice of removing part of the uterus. That's when we are talking about myomectomy. And then we have the choice of removing part of the fibroid. We have the choice of removing part of the uterus. But all the same, abination before you start the surgery, a good surgeon should be able to predict the outcome of the surgery.
And doctor, aside surgery, is there any other solution for fibroid?
Well, really, some people believe that some medications can reduce the size of fibroid within the uterus. But I don't belong to that school of thought. I think the best line of action is the removal of the fibroid and prevention in terms of lifestyle. Because we realize that the incidence of fibroid has increased because of the way of life of women nowadays. But the best treatment, as far as I'm concerned, is the removal of the fibroid. And it has to do with the position of the fibroid too, because the position of the fibroid can be in the canal within the body of the uterus. It can be within the canal of the uterus. It can be outside the uterus. And the position affects the clinical presentation, and the position also affects whether a woman can conceive, or the woman can have a pregnancy and hold it to term, or whether there will be a spontaneous abortion of fetus if there is any. So every patient is unique in the approach of managing the fibroid. But really, I don't think there's any drug that you can use that will remove fibroid totally. But there are some drugs that you can use to help in managing the clinical presentations of fibroid. How does the fibroid present? It can present with bleeding, and not with bleeding. You try to enhance the hemoglobin. You try to enhance the hemoglobin. You try to the blood status of the patient.
Now you've heard from Dr. Jolo. You can contact him through the number displayed on the screen. So, Dr. Jolo, can you please advise women concerning fibroid?
Yeah, thank you very much, Madam Moderator. Well, having fibroid is not the end of life. The real thing is that you get yourself screened and realize that you have it. And if you have it, it is better that it gets treated early enough. It is not the end of life when you have fibroid. The most important thing is to get treated. And even when you have it, no matter the grade, there's always a good way, a good chance of you having children and having a good quality of life. Ladies, the husbands of the ladies that are affected with fibroid, be rest assured that having fibroid is not the end of life. And I can assure you, it's just the beginning. Thank you very much.